In all my skeptic travels through the strange worlds of alternative medicine, esoteric new religions, and crank science, the gender ideologists are by far the most vicious and dishonest of them all. Andy Lewis, founder of Quackometer. Hello, Justine here, Homearchy channel, and I'm going to do videos on atheists and skeptics who are ideologically captured by current gender ideology and transactivism and all or most of its demands. And I'm going to start with Rebecca Watson. Rebecca Watson is the founder of Skepchic, a supposedly skeptical website that discusses current affairs and science issues. And here's one sentence from the Skepchic website. Over the years, it's grown to be home to dozens of writers who tackle those issues as well as progressive politics, feminism, and social justice. So it has a left-leaning bent. And here she is talking about efforts in Texas to criminalize pediatric medical transition for gender dysphoric youth under the age of 18.
Last month, Ken Paxton, the current Attorney General of Texas, published a non-binding opinion that parents who provide their transgender kids with science-based medical care should be investigated for child abuse. This was quickly followed by Greg Abbott, the current governor of Texas, publishing a directive to the Department of Family and Protective Services to do just that. That department immediately placed one of their own employees on administrative leave pending an investigation into that employee for helping their own 16-year-old child through gender-affirming care. The department demanded that the family turn over the teen's medical records. The family refused and has enlisted the help of the ACLU of Texas and Lambda Legal, who have filed a lawsuit to block the records request and challenge the legitimacy of Abbott's order.
First, I'm not going to go into details about talking about laws because laws are complicated, and that's not my area of expertise. I want to talk about Watson's sloppy and, in my opinion, unethical video on the safety of medical transition for minors, because she has misled the 15,000 viewers on her YouTube video in this case. She basically steadfastly avoids talking about all of the things to be worried about and all of the negatives. The reality that hormone blockers do actually impact bone health in a negative way. They cause sterility if the youth goes on to cross-sex hormones, as well as genital stunting. And there are possibly IQ effects of the hormone blockers, as well as other impacts they may have on personality and brain wiring. So all of that was left off of this video, as well as the fact that it may interfere with identity development on youth during a very important growth and exploration period of their lives. I started this video with a quote from Andy Lewis, and he runs Quackometer. I think that it would be good to go on to Skepchic's website that features this video because he has some comments in the comment section that I agree with, and I will be going over this information in detail. Not everybody who supports gender ideology and trans activism is necessarily a vicious person, but there is a lot of dishonesty around this issue. And a lot of this, even trans people do not support. So this is not about an entire population. This is about an ideology. But a lot of the dishonesty has seeped into the minds of progressive people because they feel like they're protecting this very vulnerable population. And that's causing a lot of emotion-driven reasoning and cherry picking and denying certain facts. It's also causing people to demonize people who have very legitimate concerns about this, because we're already seeing young people who are harmed. We don't know how many of them there are, but the harm to them is quite significant. This also isn't really helpful in turning this into a culture war issue. One thing I want to say about the Texas law is that people should understand that the reverse is happening. There's a very strong push in trans activism to drive a wedge between parents and their children who want to transition. I know multiple parents who have protected young people struggling with their puberty from over-medicalization. I've heard doctors talk about this in gender conferences as well, like the idea that they want to call CPS on the parents There have been court cases that are denying parental rights to parents that don't want to transition their children. Parents are losing parental rights for children as young as 13 years old. What's happening in Texas, there's also an effort to have the reverse happen. And not every youth who's being transitioned is being assessed well or has had gender dysphoria since childhood, like the older cohorts that have been better studied. People need to also understand government interference is happening in the other direction, including how Psaki recently gave a press conference indicating that somehow medical transition of minors might be somehow their constitutional right. So there are reasons why parents are concerned on the other end. And I do know parents who protected their minors from basically testosterone and possibly double mastectomy. Now I'd like to disclose my personal biases for transparency. I'm bisexual. I had some gender dysphoria as a tween. It wasn't so serious I would have wanted medical treatment, but I have some idea what that's like. I'm a board member of Gender Health Query. It is a medical watchdog organization regarding pediatric medical transition due to the fact that some same-sex attracted youth may outgrow gender dysphoria if allowed to go through puberty. We are seeing what appears to be increasing narratives of regret, and our concerns are unfortunately being validated the more time that goes on. So I call myself a homosexual / bisexual human rights activist, and I feel the need to advocate for potential desister children, those minors who will outgrow gender dysphoria, because there is almost even a hostility towards those youth now in progressive circles, and even among doctors and psychologists who promote the affirmative model, because those minors represent a roadblock to allowing this to all go forward. And they are being ignored and downplayed intentionally. So I've felt the need to hold this space to draw a line that damage to them is a human rights violation. I do care for all gender outliers. I think we need a more non-medicalized culture for gender outlying minors who are experiencing distress, more similar to what they have in Samoa, where it's very integrated into their culture. And I believe that adults should do whatever they want to with their bodies. I am very well informed and I know my information, but I'm going to be focusing on the negatives of pediatric medical transition because Watson only focused on positive quotes and narratives.
This is all obviously a gigantic clusterfuck that puts trans kids and their families at serious risk. So I just wanted to take a minute and talk a little bit about what's going on and go over a few things that I think might be confusing people because it was even confusing me at first.
Bad news, she's still confused. Either that or she's going to intentionally go on to cherry pick and mislead her followers by picking skewed information to present. She goes on to list what they are actually doing to minors in Texas and other countries, so I don't have to.
First of all, what is the gender affirming care that is suddenly considered child abuse in Texas? Well, Abbott's directive to DFPS lists the following: reassignment surgeries that can cause sterilization, mastectomies, removals of otherwise healthy body parts, and administration of puberty-blocking drugs or supraphysiologic doses of testosterone or estrogen.
Transgender is the new and popular term, but some of the older school transsexuals prefer the term transsexual, meaning a medicalized person with gender dysphoria. And the transsexuals / true scum often prefer this term because they think that gender transition and non-binary identities is becoming faddish, and they want to separate themselves from what they feel like is a social contagion. And it is there are exploding numbers of trans and non-binary identified young people, and it was a condition that was once very rare just 20 years ago. What our society is doing now is turning 11-year-old children into concretized, medicalized transsexuals. That is what we are doing. And let's remind ourselves that it's impossible to change your sex, and you can really only mimic the opposite sex through hormones and surgeries that have health consequences and other consequences, like costs and other people needing to validate you and your new identity. Transition involves major surgery and drugs that have consequences like heart attacks, strokes, vaginal atrophy, and other complications that children can't really comprehend. People will get into debates about whether or not minors can really consent to any of this, but it's good to know that a young person isn't really fully mature with full executive function until the age of 25. She does seem to think that there should be some limits to turning minors into medicalized transsexuals, and for her, the line seems to be at surgery under the age of 18.
Surgeries do sound like a big deal. Maybe we should restrict teenagers from getting elective surgery that might be difficult or maybe even impossible to reverse later.
So she's running afoul to correct language use in this ideology. She's committing speech crime in this case. These are not considered elective surgeries. I would like to address the life-saving and medically necessary catchphrases that you often hear, because in many ways they are actually debatable. You will find many studies that show if people medicalize themselves who have gender dysphoria, that they feel less depressed, that they're happy with their surgery results. Some studies show that they are less at risk of suicide ideation. And some of those studies are found in the Cornell Review. There's the Pulse Survey study in Canada. And you can refer to those because I'm going to link all this at the bottom. There are a few other studies, though, that counteract this narrative. And some of those are Marshall, Adams, and Brandstrom. And you can also find some of those listed at the bottom. So even those catchphrases should be analyzed, and people really need to look closely at all of the data before they make those statements. In this video, I'm going to focus on information challenging Watson's claims, since she totally and steadfastly avoided all of it. And I also want to mention the fact that most of these studies on trans healthcare are poor studies. They're poorly designed. There aren't control groups. They aren't really population-based studies. There's many problems with them, but we'll have to go through and do the best that we can. I also want to mention that Watson mentioned surgeries being irreversible. However, testosterone usage is also irreversible. And there are more young women who are expressing transition regret, and they are hairsuited and their voice is permanently lowered. So these are irreversible effects from testosterone use. Most of these women appear to be same-sex attracted young women, and some heterosexual ones as well, but a high number of them are lesbian and bisexual. She goes on to say that medicalization on tweens is rare and that there's a good assessment process. And I think it's really important for people to understand just how extreme what is going on in trans quote-unquote healthcare is. And I'm going to provide some examples of some of this extremity as well in the links below, but I'm also going to talk about some of this. There's really an emerging new norm to immediate medicalization of minors with really little to no psychological assessments. And this is regardless of their mental health status or whether or not they had childhood GD. And all of the kids in the Dutch model that really started this had persistent gender dysphoria from early childhood. And I think a lot of this would disturb even the most sort of open-minded, progressive-minded person if they really knew what was going on. Despite Watson's nothing to see here tone in this video. This is not the same cohort as adult transitioners who were gate-kept, or even the sort of well-screened minors that were part of the study from Holland, which is what the affirmative model is based on. And even the Dutch didn't really recommend social reinforcement from early ages due to the reality of desistance. Something Watson doesn't mention also is that there is an explosion in trans identification in young females. It's going up in male teens too for various reasons, but particularly females and young adults as well. And this is relevant because there's a very long list of social contagions involving females from the ages of about 12 to 25. And you can also find that on the link below, as well as other claims that I'm making. You can double check everything I'm saying has a citation or a valid reason. There's a long list of social contagions in young females, and since these young females are often having comorbid conditions, I think that we should be very concerned about giving them testosterone and even double mastectomies under the age of 18. Many trans activists clearly want to lower or remove age of consent laws altogether, and you'll find this attitude even in affirmative model advocates. So doctors are in fact giving hormone blockers to kids as young as 10 years old. They have stated a willingness to forego blockers altogether and administer testosterone as young as the age of 8 years old. And that is listed in a request for a government grant by Joanna Olson Kennedy from LA Children's. Also, they're doing double mastectomies on 12-year-olds, I think is the youngest age here. This graph I'm putting up shows 13. And they're doing vaginoplasties on 16 and 17-year-olds. This is strongly opposed by other mental health professionals and doctors, but you don't hear about their narratives as much in progressive media. And basically, the New York Times and Washington Post are really progressive media now. CNN, any place like that. Even though this actually is very experimental and controversial. Watson, of course, didn't talk about that either. There is a strong push to normalize this in institutions. All of the medical institutions have been taken over by very ideological-driven small groups of doctors or mental health professionals that are writing the guidelines, which is making it seem like the whole AAP or APA or AMA or whatever organization, that all the members are supporting this protocol. But you need to know that it's a certain type of person writing the guidelines. If you think that mental health professionals and doctors are always trustworthy with information, research, and the medical protocols they adopt, I urge you to research past fads like thalidomide, the medical butchery of intersex babies, the Tuskegee syphilis experiments on unsuspecting Black people, multiple personality disorder, satanic panic, John Money, and subjecting gays and lesbians to shock therapy and lobotomies. Let's address the rare claim that medicalization at young ages is rare. So rare is a subjective term. There are billions of people in the world, but medicalizing very young tweens is becoming less rare. Let's put it that way. There are hundreds of gender clinics popping up. GPs are just writing prescriptions too for hormone blockers, I'm pretty sure. As I said, there are underage surgeries. Here is a graph showing information from a study, Olson 2018. You can see mastectomies under the age of 16. Here's a quote from a trans kid support group called Mermaids in the UK. This is Susie Green, who was at WPATH, and she goes to different gender conferences. And here she says, all USA clinics in this morning's talks confirm that they use stage, not age, approach to prescription of gender-affirming hormones with the youngest age 13. Individualized approach for every young person following endocrine standards of care. So there isn't really any age limit that these people want. This is Joanna Olson Kennedy. Has anyone seen an uptick in insurance companies asking for mental health notes and signed consent prior to covering blockers? So that would be like an assessment. This is ridiculous! Exclamation point. SOC 8 has to eradicate gatekeeper letters as a requirement for care. The WPATH is the only thing they refer to and subsequently misinterpret. So WPATH was recommending at least psychological assessments. She doesn't want that. A lot of them don't either. So they completely ignore the fact that there is research that some youth outgrow this through puberty, and they just want to affirm it. And given that there is some bad news about hormone blockers, they are just skipping blockers and going right to cross-sex hormones. And you can find accounts of this from Parents of Transgender Children Facebook group. My daughter transitioned socially at age 9. She started blockers and estrogen at age 13. And another person responds that says, yes, a lot of endos are doing this, and they don't publicize it due to the current political climate. So they're medicalizing very young tweens, and they are not talking about it because they don't want you to know. Here is another comment. The child got a blocker at 10 and a half and started estrogen at age 11. This brings me to Watson completely ignoring the exploding numbers of females identifying as trans and the increasing complexity of the cases. All of that information can be found easily if you choose to research it. There is robust justification for worrying that there is a social contagion in trans identification, given the lopsided population data regarding trans identification in young people versus older people. You can also find that doctors are marketing breast amputation on social media like TikTok. I think this should be concerning given the increasing numbers of females wanting medicalization and the increasing data showing that they have a lot of mental health problems. This should be concerning given you can definitely find more stories of transition regret. Here's a surgeon who posts videos of double mastectomies and expresses glee over yeeting the teats of minors. In this graphic, she's looking pensive and very sad that she only gets to yeet 4 teats next week. This surgeon is in Florida. And here's a tweet of somebody asking if anybody's interested in suing this doctor. Here's another doctor in Canada, and this guy likes to pose with biohazard buckets that are filled with the breasts of minors and young adults. I believe complaints were filed against this doctor, but they are essentially marketing these surgical techniques to cognitively immature biological females on sites for young people. There are pretty extreme things going on with the parents. They are posting pictures of their own female children's mastectomy surgeries on social media. Here you can see she has self-harming scars all over her body. And I have a strong feeling this double mastectomy is not going to solve her problems. Here's a picture of a mother who has put on a party regarding her female child's breast amputation. And you can see that there is a Yeet the Teats cake, breast cookies. On one side are breast cookies, on the other side are cut off breast cookies. They have a red line around them. So this is becoming very normalized plastic surgery and extreme body modification on minors. Here's something particularly disturbing about that cake. This is what the mother says about her child. My son was 9 when his stepdad, who was his rock, killed our 4-year-old daughter, then himself. He's now 16, and I've noticed many things over the years where he is still 9, quote unquote. So she's admitting the youth still seems very immature. Plus, I've read that as kids hit brain growth, they relive it all over again, which I have seen. So this is a emotionally struggling young person who is receiving a double mastectomy for gender dysphoria, probably around the age of 16 years old. There's a lot of other extreme things that you find on the Parents of Transgender Children Facebook group. Some of them have multiple trans-identified minors. Some of them seem to be actually excited about transitioning their children. And in my circles, they're called munchie moms or transhausen moms. And I've absolutely seen this. Parents that definitely seem excited about transitioning their children. It's very disturbing. They seem to be encouraging their minors to medicalize, even when the children are expressing fears around the medicalization. And I'm not saying this is the case with most or majority of the parents, But this is definitely something to be concerned about, given that borderline personality disorder in parents is real, and parents wanting attention is real, mothers seeking to have a special sparkle child. These are actually real things, and you will find it in this Facebook group and other places. I could give a lot more examples. In fact, on Rebecca Watson's video, there is one comment that says, as the parent of 3 trans children, I thank you. I'm going to repeat that. 3 trans children in a condition that was maybe 1 in 10,000 people 20 years ago when people knew about medical transition. The odds of that are extremely small. Right. No social contagion. Nothing to see here. Now I'd like to address the good assessment. The statement she makes indicating minors are being carefully assessed is outright false. I'm sorry to tell you. At least in some cases. I communicate with a lot of people in parent groups and people in the mental health profession and even medical profession. And minors are being affirmed immediately for medicalization. And this is being promoted because of the suicide narrative being pushed, which I'll address a little bit, and the politicization of this issue. They want conversion therapy bans piggybacked on the gay rights movement, and conversion therapy practices aren't really happening for gay people, but they're pushing it as if there is because they want to latch on trans care so they don't really question these minors and the medicalization of them at increasingly younger and younger ages. Here are some stories about what they're really doing. This is a parent that contacted Gender Health Query. There are a lot of stories like this. They are very easy to find. This was the parent of a child that wound up at a gender clinic in a hospital in a state in the United States, and everybody, including the mother, was promoting medicalization almost immediately. Here the parent says, recently, my daughter has desisted and is back to identifying as her natal gender. The cessation of the 2 years of identification happened almost as fast as her coming out as transgender 2 years prior. You should know that that's enough for a DSM diagnosis, which justifies medical treatment in this climate. It terrifies me to think that had I lost parenting rights decision-making during my ex's court challenge, my daughter may have been allowed to medicalize her transition. It terrifies me that there's a mental health community who may have very little understanding, training, information that is encouraging medicalization of children. Through the process of transition, I reluctantly consented to a consultation at the Children's Hospital Transgender Clinic here in blank state. I consented under pressure from my ex with her court case. I felt I had to show that I was supportive of my child's transgender identification. Fortunately, there was a 6-month wait list for consultation. I fear if we had gone to our consultation, the transgender clinic might have recommended hormone therapy. This would give my ex more professional backing, along with other mental health professionals' opinions, to either pressure me to consent to medicalization or worse, the court to limit my parental decision-making. Luckily, my daughter desisted before her name came up on the wait list. Here's another story on American Conservative, and I know that that's a conservative site, but you can find these stories told by very liberal parents as well. My own daughter professes to be a boy. It's a nightmare. It came out of nowhere at age 15. This is not a case of a girl who always wanted to be a boy or always acted like a boy. This is a girl who was proud to be a girl until she developed physically, and boys and men started treating her like a piece of meat and a second-class citizen. The nightmare is that doctors and therapists are not allowed to question why she wants to be a boy. So they are ready to prescribe testosterone shots and double mastectomy despite the fact she is a minor. These physical medical treatments, quote unquote, for her psychological problem are permanent and barbaric. It is against ethics for professionals to provide any other treatment. Ethics in quotes. It's a mother's nightmare. This was a parent that contacted me I was in communication with. After I posted this, some parents contacted me who have a daughter who had no history of childhood gender dysphoria. She had been hospitalized for being suicidal twice as a tween and not because of dysphoria. She suddenly came out as trans a couple of years later, lied to the gender therapist about key issues, and is starting testosterone as a minor. The parents were told to put her on testosterone at the first appointment. The gender therapist never asked the parents about depression or anxiety possibly contributing to this. The gender therapist interviewed the parents to deem them oppressor or non-oppressor in their words. This was during only one meeting, where they never asked the parents for any input about the child's history. These said they were confused before they went into therapy and within a very short time was starting testosterone. These parents were shocked at the speed of which their minor was affirmed as needing drastic medical intervention with permanent effects. You can also read accounts like this on Fourth Wave Now. The mother that founded that website was basically told over the phone by one of the therapists that her daughter was trans. The daughter later desisted after a couple of years of trans identification. This is a quote from an article called The Sudden Surge of Transgender Teens, and this was actually written a few years ago. I would say things have gotten worse. Another friend's 14-year-old son began identifying as a trans girl last year, but doesn't present as female, doesn't wear feminine clothes, have girl friends, or even shave her mustache. So when multiple Los Angeles therapists urged them to start the kid on hormone replacement therapy, the parents resisted. All of them are pushing our child down that road, and our child is not showing us that she wants to go down that road. It's really dangerous, says my friend, who is about as progressive as they come. I mean, we don't even let her eat chicken with hormones in it. You can read an article called Top Trans Doctors Blow the Whistle on Sloppy Care. This was written in October 4th. Rebecca Watson easily could have found this article. It is from Erica Anderson and Marcy Bowers, highlighted by Abigail Schreier on Barry Weiss's Substack. You might not like Barry Weiss or Abigail Schreier for not being sufficiently leftist, but Erica Anderson and Marcy Bowers are both trans. One is a psychologist, Marcy Bowers is a surgeon. And they are expressing a lot of concern about what is going on with exploding numbers of trans-identified females, the complication of cases, and the fact that hormone blockers stunt genital development, as well as other problems. The subtitle of that article is, In Exclusive Interviews, Two Prominent Providers Sound Off on Puberty Blockers, Affirmative Care, the Inhibition of Sexual Pleasure, and the Suppression of Dissent in Their Field. Here's a quote from Laura Edwards-Leeper, a psychologist. She's Norman Spack's protege, who was an endocrinologist who normalized this protocol in the United States. And Edwards-Leeper is a psychologist. She wrote an article in the Washington Post called The Mental Health Establishment is Failing Trans Kids. Gender exploratory therapy is a key step. Why aren't therapists providing it? The date of this is 11/24. This is before Watson's article. She just didn't even try. She really didn't. People should also know that they're medicalizing non-binary identities. There's no research to validate medicalizing a non-binary identified 13-year-old child. Diane Arensaf's criteria for this is called apples, oranges, and fruit salads, and that's about as scientific, quote-unquote, as it gets. She just kind of goes with her gut. I think maybe we need to worry about a 12-year-old, quote-unquote, fruit salad who is wanting to medicalize themselves with no research on the long-term benefits of that. As far as other extreme things that are going on with this, I think it's good for people to know they're doing full genital amputation surgeries on people who describe themselves as nullos, so they want no genitalia at all, or they completely remove the nipples. Some young people are actually seeking surgeries that make them have scars so they look trans. I think people should know that phallo is a pretty horrific surgery with a very high complication rate, with side effects so severe it has put people in colostomy bags and almost killed them. This is a pretty extreme field. I've also seen doctors and mental health professionals talk about how they transition very psychologically disassociated people who are not in touch with reality, people that say they have multiple personalities, and people with schizoid personality.
Puberty blockers do essentially what it says on the tin. They press the pause button on the flood of hormones that we get when we enter puberty. They are completely reversible in that once you decide that you want to start puberty, you simply stop taking the puberty blockers and boom, your body knows what to do. Your hormones leap into action.
There's no excuse for her saying this. There is plenty of information out there showing that there can be very severe consequences to minors taking puberty blockers. In fact, you can find this information within the first 2 pages of Google searches using the terms we are discussing here. This person really appears in no way skeptical. Let's even just assume it's a small minority of minors that will experience these side effects, but they are quite serious. I think the damage being done to them matters. The claim that blockers are fully reversible is a wholly unsubstantiated claim when we are even just talking about psychological effects. Nobody really knows the effects of them on identity development, especially when they would give them to minors with precocious puberty and then take them off of them when it was time to go through puberty. You can find a lot of the doctors saying this too. It's negligence to make this claim. Other sites in Sweden and the UK appear to be correcting this narrative because there's negative information coming out about hormone blockers, which I'll go into. Her claim that they're fully reversible is really a half-truth, and she's leaving out the other very important half. So GnRH analogs, aka hormone blockers or puberty blockers, are used for precocious puberty, cancers, endometriosis, and to chemically castrate sex offenders. And they are not new drugs, and there are multiple studies that do claim a strong safety profile in using them for precocious puberty, which is not the same thing as on healthy children in puberty. These would be kids who are going through puberty at maybe 7 years old, and there's negative health effects from that. Tweens are healthy children who have psychological problems, who are gender dysphoric. Different situation. They are not approved by the FDA to stop normal occurring puberty in physically healthy young people for psychological distress around a physical appearance. The use is currently considered off-label and highly experimental. From KTNV in Las Vegas, the FDA currently has over 25,000 adverse event reports for Lupron products, including more than 1,500 deaths. Reactions include suicidal thoughts, stroke, muscle atrophy, and debilitating bone and joint pain. There's now evidence that hormone blockers cause enough harm to use bones that Karolinska Hospital in Sweden is either stopping altogether or curtailing this process due to damage that they've seen in young people. And other countries like Finland, France, and UK are expressing a lot of skepticism about the safety of this. Blockers likely affect normal brain organization, and so they're really impacting the personhood of these young people by interfering with their development. She calls the blockers reversible, but some of the major effects are pretty significant when they actually go on to HRT, which they usually do. The blocker to HRT protocol, path, solidifies sterility and stunted genitals and anorgasmia in some minors. So there are irreversible effects to the blockers once the HRT is commenced, and she left that part out. These are pretty valid reasons to worry about giving tweens blockers. There are valid reasons to worry giving blockers to tweens risks driving pre-gay and lesbian kids into medicalization, drastically interfering with their normal identity development. All prior research shows that significant numbers of children with clinical gender dysphoria outgrow gender dysphoria if allowed to go through a natural puberty. None of this is mentioned by Watson. I don't know if she's making this fully reversible claim out of dishonesty or laziness. Neither is admirable.
Delivered into the body via usually monthly injections or through an implant in the arm, like this one that I have in my own arm that prevents me from getting pregnant. It's pretty cool. That's right. I'm a cyborg, and it's fucking awesome.
Dennis Noel Kavanaugh is a gay man and a firebrand on Twitter. And he calls people who market a dishonest narrative around gender identity, activism, and its extremist behavior as genderborg. I think Watson is more genderborg than cyborg. She's just not even trying to air the legitimate concerns people have. They aren't all right-wingers from Texas. They are gay and lesbian people and liberal parents and even trans people who oppose pediatric medical transition because they believe it's dangerous. I'd like to ask Watson if she thinks that micropenis and not being fully sexually functional is a cool side effect from having a Lupron implant, the way that she has a hormonal implant in her arm as a obviously sexually active adult. Now is the time to go into ghoulish detail about what puberty blockers do to boys who want to be girls. This is a detransed male. I don't know what people will think of me. Hi, I am male, just turned 18, wanting to share my story with transitioning, detransitioning, and ask if anyone went through something similar or has advice for my situation. I came out as transgender when I was just a little boy. I was already living as female by age 7, with a new name and long hair. My transition was different than most in that I was put on hormone blockers when I was very young. Right as I started puberty, 11, and then female hormones at age 14. As you can imagine, for someone on this subreddit, the results are devastating. I certainly appear different than most men my age. Due to the hormone blockers, I never developed past Tanner stage 2. As a young teen, my body was hairless and I had no sexual desires at all. As an adult, I am 5'3". My genitals are extremely underdeveloped. I grew breasts. I wear a man-size 5 shoe. I came to terms with the idea of being male itself and detransitioning, but the problem is doing it while looking the way I do now. I started low-dose testosterone shots a few weeks ago to jumpstart my system, and I'm having my levels monitored in the meantime. I know certain things can change, like my voice and body hair, but my growth plates are almost certainly fused, so I'll be short for the rest of my life. I'll have to have surgery if I want to fix the gynecomastia. I have no clue if my genitals will change. I may look like this forever, and I'm terrified of other men's reactions. So he's going to have to navigate this in the gay male community. I don't know how people will treat me once my voice drops and it becomes clear I'm not a woman, just a smaller, weaker, inferior guy. I don't know what they'll think, and I know my situation is rather unique with the hormone blockers, so I wonder if any of you have advice. I know I have to do this, but my biggest fear is that I'll be respected even less than I am now. There's a few other stories like that you can find, and I can't verify that person's particular identity or any other anonymous account, but we know that this happened to Jazz Jennings. They have known about this effect since 2008, yet they are still doing this, and there could be potentially thousands of minors at the crack of Tanner 2 that have been subjected to this. This is from the Top Trans Doctors Blow the Whistle on Sloppy Care article. Another problem created by puberty blockade was lack of tissue, which Dutch researchers noted back in 2008. At that time, Cohen Katenis and other researchers noted that in natal males, early blockade might lead to non-normal pubertal phallic growth, meaning that the genital tissue available for vaginoplasty might be less than optimal. But that hair-raising warning seems to have been lost in the trip across the Atlantic. Many American gender surgeons augment the tissue for constructing neovaginas with borrowed stomach lining and even a swath swatch of bowel. Bowers draws the line at the colon. I never use the colon, she said. It's the last resort. You can get colon cancer if it's used sexually. You can get this chronic colitis that has to be treated over time. And it's just in the discharge and the nasty appearance, and it doesn't smell like a vagina. The problem for kids whose puberty has been blocked early isn't just a lack of tissue, but of sexual development. Puberty not only stimulates growth of sex organs, it also endows them with erotic potential. If you never had an orgasm pre-surgery and then your puberty blocked, it's very difficult to achieve that afterwards, Bowers said. I consider that a big problem, actually. It's kind of an overlooked problem that in our informed consent of children undergoing puberty blockers, we've in some respects overlooked that a bit. Rebecca Watson needs to understand that she's supporting a protocol that is sexually lobotomizing children. An 11-year-old is still a child. Let's be clear. That's an accurate description. You can see more links below of Joanna Olson-Kennedy and Laura Edwards-Leeper in Facebook groups treating this whole side effect as an afterthought that they didn't even seem to consider ahead of time. I want lawsuits against anyone who's done this to a person based on a decision they made as an 11-year-old child. Rebecca Watson wants to ensure that it continues happening completely unopposed, with anyone raising concerns demonized as crazy right-wing Republicans. I think Rebecca Watson should know that not all trans people are even dysphoric about their genitals. So you're taking away a lot of choice. Also, there are men with a sexual orientation called GAMP who actually like unaltered feminized males. So maybe we shouldn't be drastically medicalizing such young people. And I think that skepticism is actually asking these kinds of questions, but you won't find it in her video. In the show notes, you can find a link by Paul Bassi, who talks about non-medicalized third gender cultures in southern Mexico and Samoa, also, who do pretty well. And he says they even have better lives than they do in Canada, where they have publicly paid for transition surgeries, and it's a very liberal country. So I think we need more skepticism about the culture we're creating here.
For trans kids, puberty blockers can be a godsend, or a science send, I suppose.
In the interest of fairness and not wanting to just monster people who support this protocol, I want to address her use of the word godsend. I've already mentioned that there are studies that show a reduction of gender dysphoria and an improvement in mental health in many of the trans research studies. And also, I've provided links to a few that counter that narrative as well. But I think it's really important to acknowledge the genuine distress that these young people feel. Some of them will even try to get hormones on the black market. So I don't want to pretend that there's no ethical dilemma here. And I wish that Watson had been charitable enough to acknowledge the issues on the other side of her arguments. But I think that it's important to understand that these body dysmorphias are very strong drives in people, and people will do extreme things to want to relieve that kind of emotional distress. And I'm familiar with many of the gender clinicians, having listened to a lot of their videos and gone to gender conferences myself. And I think some of them have God complexes, but I am sure that also a lot of these people really are trying to help and do what they think is right. And this protocol seems to be the best way to help males, and particularly pass better. And the concern is that males who transition who don't pass get discriminated against, and it makes them hard to hold down jobs. That's probably a very real concern. I want to acknowledge that, but now I'm going to go over the more alarming things about pediatric transition.
You can probably imagine that if you fervently think that you are, say, a girl, things might get really upsetting when you start getting random erections and sprouting heavy facial hair. Hell, I find it upsetting when I sprout heavy facial hair and I'm not even trans.
First, Watson talks about the dislike of her own body. And someday I want to do a video about how the idea that medical transition for gender dysphoria as life-saving and medically necessary is a little bit of a scam, in the sense that body dysmorphic issues and other body hatred issues in mostly women, but not completely, are pretty much almost as serious and are not funded by insurance or public health care because they're considered elective. But that'll be a different video. I think it's good for Rebecca Watson to know that there's often a honeymoon period in medical transition. I've heard about gender clinicians talk about this at gender conferences, that the youth will get one step taken care of and then crave the next step and then become more dysphoric again and then crave the next step. Do you know what that sounds like? It sounds like body dysmorphic disorder. You know what's contraindicated for that? More medical treatments. So I think we need to be more skeptical about foregoing all the other things that make a person whole and happy and strong to cope with difficult emotions, rather than just throwing scalpels and Lupron and hormones at them. I'm just musing, but my point is, I think a legitimate skeptic should be asking questions like this.
It's not fun. Teens can start puberty blockers anytime after puberty begins, usually 12 or so at the earliest.
9 or 10, with a claim they're willing to give female children testosterone at age 8.
They help by giving a teenager time to consider what they truly want, or time to get ready for what's coming down the road.
Baseless and inaccurate claim. Gender Borg. But you assimilate points Gender Borg should well. First, I think most people would have the common sense to recognize that puberty is a very important developmental period in a person's life, and that cluster bombing it may cause very significant changes in that person's trajectory. Let's talk about puberty in general, the importance of it, and the health professionals who admit that they really have no idea what they're really doing to these tweens and teenagers. Here's some comments about puberty in general. PBS.org, pediatrician Dr. Lisa Simons. The bottom line is we don't really know how sex hormones impact any adolescent's brain development. We know that there's a lot of brain development between childhood and adulthood, but it's not clear what's behind that. Here, in Brain Cognition, Commentary, a behavioral scientist looks at the science of adolescent brain development by Lawrence Steinberg. For example, puberty-related increases in gonadal hormones have been linked to proliferation of receptors for oxytocin within the limbic system, including such structures as the amygdala and nucleus accumbens. Oxytocin neurotransmission has been implicated in a variety of social behaviors, including facilitation of social bonding and recognition and memory for positive social stimuli. In The Conversation, brain scans reveal why rewards and punishment don't seem to work on teenagers, by Gnrha Rippon, Professor Emeritus of Cognitive Neuroimaging. Adolescence is defined as the period of life that starts with the biological changes of puberty and ends when the individual attains a stable, independent role in society. This definition may leave some readers wistfully pondering the second half of that equation. We now know that it's also a time of tremendous brain reorganization, which we are only just beginning to understand. We've established puberty as delicate, little understood, and extremely important in forming the personhood of the individual. Second, within a few minutes of research, you can find gender clinicians, sexologists, doctors, and developmental psychologists who believe hormonally interfering with puberty should be a major concern, and the concern isn't just hormone blockers, but early social transition. Why is that? Well, many studies show that children with gender dysphoria, clinical DSM, diagnosed gender dysphoria, may outgrow it and are likely to grow up to be gay or lesbian, which is why I'm involved with this issue. Trans activists lie about this. Affirmative model advocates downplay this, and they do it because then that scenario winds up being a roadblock to allowing dysphoric children to transition before puberty. The stat I like to use for desistance is 67%, which is an average attained from 4 of the more recent studies on childhood gender dysphoria. And so, no, not all of these kids are just kids who liked pink. There probably was some overdiagnosis, but some clinical distressed children can resolve their gender dysphoria when they go through puberty. I noticed that Watson has what looks like a rainbow bracelet. I'm wondering if she's bisexual, or I guess woke people say pansexual now. I don't know. Maybe it's just a colorful bracelet. I think it's good to talk about how it's not the Christian right who's most concerned about this, but really gay, lesbian, and bisexual people, and then probably feminist groups and parents and liberal doctors and mental health professionals. That's who's mostly watching this, not really just the Christian right. There's a pretty appalling and callous apathy about what this is going to do to potential desister children of all orientations. This apathy is definitely very prevalent in quote unquote skeptics and atheist circles. It's just really as if these kids, not only do they not matter, but we need to have a lot of hostility towards any people who actually express care for them. You can refer to an article I wrote that's linked below called "Do Youth Transgender Diagnoses Put Would-Be Gay, Lesbian, and Bisexual Adults at Risk for Unnecessary Medical Intervention?" Because they do, and we're seeing more of their stories on RDTrans, a subreddit that has thousands of people on it now. The concern isn't just medicalization, but also social transitions. This is what Ken Zucker said. He's not liked because he had a more cautious approach, but one of the reasons for that is he didn't want to over-medicalize, like, mostly pre-gay and lesbian kids. And he says, "I predict, therefore, that in contemporary cohorts of children who experienced a GST prior to puberty, that the rate of GD persistence will be substantially higher than that reported in follow-up studies to date." He's straight up saying this is going to groom proto-gay kids for medicalization by interfering with their puberty. This is a researcher, Corte, in Gender Identity Disorders in Childhood and Adolescence. Even among children who manifest a major degree of discomfort with their own sex, including an aversion to their own genitalia, GID in the strict sense, only a minority go on to an irreversible development of transsexualism. Irreversibility of the manifestations, however, is considered to be an indispensable requirement before the diagnosis of transsexualism can be made, or any body-altering treatments initiated. Okay. Here is a quote by Norman Spack, who normalized pediatric transition in the United States. "There is no consensus among mental health professionals regarding appropriate intervention, or even appropriate goals of intervention, for children diagnosed with gender identity disorder." Dr. James Barrett, a psychiatrist at the Charing Cross Clinic, the oldest gender clinic in the UK, said he has concerns about treating children with cross-sex hormones because he says this: "If you wait until puberty has got a little way along, a fair proportion of the children change the clinical presentation and feel more like a straightforward lesbian and gay kid. They don't seek social change anymore and will end up with no need for lifelong medical intervention, surgery, and no loss of fertility should they want children." I would like to refer people to links below about a long list of social factors that influence gender dysphoria, like homophobic bullying, like unstable homes, like mothers who have borderline personality disorders, like peer bullying, trauma, childhood sexual assaults, peer contagion. If you really want to believe that this is all just about innate gender identity in all of these cases that needs to be medicalized starting very young ages. You should also know that Thailand had to lower their age of consent due to damaged ladyboys transitioning at too young an age. And also a study by Lisa Lippman demonstrating pretty much strong social contagion likelihood. So now let's talk about persistence with hormone blockers. This is in a presentation that was on the WPATH website from the UK clinicians. This has been taken down now for some reason, but here's the quote. Persistence was strongly correlated with the commencement of physical interventions such as hypothalamic blocker, and no patient within the sample desisted after having started the hypothalamic blocker. 90.3% of young people who did not commence the blocker desisted. That sounds concerning. Carmichael, here is a quote in The Guardian. Carmichael says it's very important for young people to experience some of their puberty. The blocker is said to be completely reversible, which is disingenuous because nothing's completely reversible. It might be that the introduction of natal hormones, those you are born with, at puberty, has an impact on the trajectory of gender dysphoria. Even though the idea of experiencing any natural puberty might horrify the Kings and the Wilsons by inhibiting it completely, Tom and Julia might be denied the chance to fully explore who they are. In a radio event, Dr. Wren from the same clinic said, the younger ones can really, really want to be girls or boys, and then they can give that up, and their relationship to their bodies can settle down quite comfortably. If we can help some of those young people through adolescence, they might make a different choice later. Desistance appears very rare once they go on hormone blockers. Let's look at some numbers. After I pick up my earring that just fell off and broke. Take them off. 100%, 98.1, 96.5, 98%, 100% persistence. Some of these might have various screening processes, but definitely once they go on blockers, it looks like they're not coming off. In the article, Top Trans Doctors Blow the Whistle on Sloppy Care, here's a quote. When I asked Anderson if she believes that psychological effects of puberty blockers are reversible, she said, I'm not sure. When asked whether children in early stages of puberty should be put on blockers, Bowers said, I'm not a fan.
Once the teenager is older, current recommendations are 16, but exceptions have been made for as young as 14. If it's a particularly mature teenager, they can decide to go off the blockers and then...
She just pulled that out of Gender Bork ass. I recommend anybody go on TikTok or YouTube to truly assess the level of maturity of some of these teenagers who are transitioning. She states that they can go off blockers at age 14. Just to remind you that they're even talking more and more about just skipping hormone blockers altogether because of the bone impacts. I guess we're just going to amputate gonads and get them on cross-sex hormones immediately.
After a year or more on those hormones, they can then decide, so around the age of 18, if they would like to proceed with surgeries.
It's easy to find information that minors are undergoing surgeries. They actually want the minors to undergo the vaginoplasties at age 16 or 17. And the reason for this is that they are not mature enough to handle their dilation schedule in college or wherever else they go when they leave the house at 18. Once you get a vaginoplasty surgery, it's important to dilate very consistently, and I believe this is something that you'll have to do permanently because the body wants to close up that what it thinks is a wound. And so they want the parents there to observe the minor so the vaginoplasty doesn't close up. They are not mature enough to handle a dilation schedule. They are mature enough to decide that they're definitely going to be trans their whole life, to chemically castrate themselves at age 11 that will stunt their genitals, and then they can agree to have surgeries at maybe 16, but they're not mature enough to handle the dilation schedule without the parent. You can find Johanna Olson Kennedy stating this and other doctors stating the same thing, that it's better to do it under the age of 18.
But opponents claim a few things about puberty blockers. The things I saw most often, number one, that they're irreversible, which is untrue. As I mentioned, they are easily reversible.
I have debunked that statement. And if there's ever time not to spin data or cherry pick things or be completely lazy in your research. It's when you're taking thousands of children, giving them drugs that are used to chemically castrate sex offenders, and then possibly sterilizing them and stunning their genital development and impacting their bone health. That is not the time to be lazy about doing research and then presenting information to the public as if you know what you're talking about. It's also not good to be lazy about the research when you really should know how much this could possibly endanger the sister minors. It's also not good to be lazy about research when the cohorts are rapidly changing from what was dysphoric boys from a young age to many more female tweens and teenagers who are struggling with puberty. Gender clinics might be 75 to 2/3, 75% females now.
And two, that they may cause a loss of bone density and possibly sterility later in life. When I was looking into these claims, I saw things like that mentioned even in places like the Mayo Clinic's website, where they say that blockers might cause these things. That's not good enough for me. So after reading far more research on this than honestly I would like.
After doing little research on sites that would bias my happy clappy messaging to make myself feel good about saving trans children.
It appears to me that the medical consensus is that none of that is true.
I am now believing this is willful deception and not just laziness.
Puberty blockers do not cause loss of bone density or sterility.
False.
A systematic review of the literature by authors designated by multiple pediatric endocrinology societies from around the globe found adverse effects of GnRHA therapy are rare.
She managed to pick the most optimistic quote from the study, but she flashed the abstract on the screen to make herself seem skeptical. Let's read some other quotes from the study. The impact on BMD, that's bone mineral density, is concerning since lumbar spine Z-scores at age 22 were found to be lower than those observed prior to treatment, suggesting a possible permanent decrement in BMD. Thus, it is unclear how long GnRHA can safely be administered. The effects of GnRHA on adolescent brain maturation are unclear. GnRHA therapy prevents maturation of primary oocytes and spermatogonia and may preclude gamete maturation. And currently, there is no proven methods to preserve fertility in early pubertal transgender adolescents. Care for each adolescent must be individualized with awareness of gender fluidity and ethical guidelines. They also admit low-quality evidence for the treatment of gender dysphoric youth with these drugs. And here's another quote. While much of the information discussed above is not published in well-controlled studies, or even published at all, this concise summary has included items that are pertinent to the diagnosis and care of those treated with GnRHA. It is clear that many changes have occurred in the clinical use of GnRHA without the benefit of peer-reviewed publications.
Puberty blockers do not cause loss of bone density or sterility.
I'm going to play a couple of clips from a Swedish journalist named Carolina Gemsby, maybe it's Carolina, who does documentaries as an independent journalist, and she does some of them for their version of the BBC or NPR, something that would be similar in Sweden. She's been reporting on harm that has befallen young people treated for gender dysphoria with puberty blockers in gender clinics in Sweden, including Karolinska Hospital, which is considered one of the best hospitals in the world. Here she's going to talk about Leo, who now has a malformed spine, who cannot stand for more than 15-20 minutes without pain.
Your documentary focuses mostly on Leo, who I want to get to in a minute, but what are the overall numbers here? Because basically the way you reported this out is you got hold of more than a dozen records proving there were severe side effects, correct?
Yeah.
What was the total number?
It was, we were able to prove that at least 12 children, apart from Leo, so a total of 13 children, were being severely harmed by these hormone treatments and puberty blockers treatments. Yeah.
What were some of the symptoms?
It was osteoporosis. How do you say in English? Like lowered bone density. It's
osteoporosis, right?
Yeah, osteoporosis. But it's not really osteoporosis. What he has, like the level below. But he also had 2 vertigos in his spine that has changed. Changed the way they look. They are more this is like how to explain it in English. They're more
basically spinal damage in someone who's
spinal
14
damage,
years old.
Definitely, yeah. And he's suffering from pain every single day. He has a problem standing up for longer than 15-20 minutes, and he's 15 years old. And he's also been a lot shorter than expected, his length. And this is a side effect of puberty blockers. I mean, the skeleton won't be mineralized. You will stop growing. And the whole idea is that once you stop the puberty blockers, everything will take off again. But shown with Leo, it doesn't always do that. But we also seen children that had side effects on their livers. We have seen children who became very, very depressed, so depressed that they were even put into hospitals after suicidal attempts from after starting with puberty blockers. And I mean, the whole idea with puberty blockers is to make the person feel better mentally. We also seen effects on with testosterone. Obviously, that young patients have been treated with testosterone, and after a year, 2 years on the hormones, they decided that no, I'm actually a girl. I don't want to become a man. Meaning they already had a deeper voice. They already had
permanent effects, in other words.
Permanent effects that will never, that will not.
And that's important. I mean, we're going to get to the question of like what the percentages are in a minute, but that right there is important because the argument you hear if you report on this issue is that kids are very carefully assessed, and they don't put anyone on puberty blockers or hormones whose identity isn't more or less set. So this would suggest that in some cases at Karolinska, that wasn't true, right?
Absolutely.
Puberty blockers do not cause loss of bone density.
Here is a graph of bone density loss from youth treated with puberty blockers in the UK. This graph is regarding a study by Joseph, Ting, and Butler. A professor at Oxford named Michael Biggs reviewed the studies and found flaws with it. And they did lose bone density that was significant. Originally, they basically said, oh, no big deal, this is great. Here's a quote from Michael Biggs in a letter in the Journal of Clinical Endocrinology and Metabolism. What really matters is the lower tail of the distribution, but this information was omitted by Joseph et al. This letter analyzes individual data on 24 patients from Joseph. It finds that after 2 years of GnRHA, up to a third of patients had abnormally low bone density, in the lowest 2.3% of the distribution for their sex and age. A few patients recorded extremely low values, in the lowest 0.13% of the distribution. It has become very necessary to medical watchdog doctors and mental health professions in this area of care, and I can only understand it by studying past fads, medical fads and mental health fads. But there is a very strong motivation to present all of this as safe and happy and healthy as possible. It's really causing people to subject youth to sloppy care and not communicate risks honestly to the public. There are other people who do this. Jack Turbin is another researcher who does pretty sloppy studies, yet the media really enjoys quoting Jack Turbin, and you can read critiques of his work. Here is another clip about the sloppy care at Karolinska Hospital.
To try to understand like how many children has actually suffered from side effects, because it can be so many more than anyone has suspected up till now.
Yeah, I mean, it's worrisome because even if these 13 were the only kids with side effects, and we know that's not the case, that would still suggest, you know, if you run the numbers, you know, maybe 5% of the kids at Karolinska have serious side effects. Even that would be a big enough number that parents should at least know about it, but the real number has to be higher just because we haven't looked, right?
Yeah, like one professor said to me, she was like, yeah, you know, we stopped the AstraZeneca vaccine against COVID because like 1 in a million get severe side effects. And now why are we accepting this? So, no, but it's absolutely a lot more children. Several hospitals that I spoke with, I had medical doctors and endocrinologists telling me that they too saw side effects, but they didn't report it. They saw lowered bone density. They saw all these side effects, and they were like, yeah, we're really worried about it. But we continue to treat as we're supposed to do, and we just hope that it will go well in the end. But we don't know, and we are worried.
Rephrase a question I've already asked you, but no one in Sweden, none of the authorities or none of these hospitals or clinics has really checked. We just don't know how many kids there are like
no
this.
One has checked. No one knows how many children that are suffering from side effects from these treatments. No one knows.
Yeah, I guess what jumped out at me is that your medical system is so much better than ours, and I think any problem, I'm just editorializing here, I think any problem you guys have is probably worse here, and that's what worries me about this.
Puberty blockers do not cause loss of bone density.
So here are some other studies that indicate there should be concern about bone loss. Navabi, 2010. Klink, 2015. Stoffers, 2019. Shagan, 2020.
Puberty blockers do not cause loss of bone density. Puberty blockers do not cause loss of bone density. Puberty blockers do not cause loss of bone density or sterility.
There are studies that I've linked that state there isn't a fertility problem with hormone blockers, and these studies are for precocious puberty, not on healthy tweens with gender dysphoria. But given that most of the children will go on cross-sex hormones, they will be sterilized, or at least it seems so in most cases. If the blockers lead to that decision, or the blockers preclude that process, they are sterilizing themselves because of the blockers. So it's not really correct to say that the blockers are fully reversible when they go on HRT. You can read an article below called Shriveled Raisins, the Bitter Harvest of Affirmative Care, because that's what their gonads will look like because of this process. And it's good for you to know that trans people have sued due to being sterilized. So fertility is obviously important to some trans adults, and there was a non-binary, I believe, identified person in Utah who sued a physician for removing ovaries. People in Sweden had to undergo organ amputation for their transition, and they sued because of sterility. So maybe we shouldn't be sterilizing children based on decisions they make at the crack of puberty. Here are some other things that blockers affect, and I'm just going to be brief here because this is running long. But there's evidence that hormone blockers might affect IQ. This is from an article in the Journal of Pediatrics, It says, contrary to laboratory studies, a recent study by the Dutch group on its own human patients asserted that no difference could be found in executive function between mid-teens on blockers and controls. Little reassurance can be gained from this conclusion, however, because close reading of the results reveals that males on blockers transgendering to females did have significantly lower accuracy scores than control groups. There is another study on sheep that show that their spatial reasoning skills are negatively impacted by hormone blockers. There is a case study called Schneider, 2017, where the IQ was 80 at the beginning of administering of the puberty blockers and then dropped down to 70 by the end. As I said before, puberty is a very delicate and complicated and very important process. These hormones don't just affect, the gonads and sex characteristics, they affect other parts of the body as well. Another paper, Hayes, 2017, the contention that a decline only becomes clinically interesting if it is at least one standard deviation is unconvincing. Any findings which indicate that GnRHAS cause a decline, even a modest decline in IQ, are likely to be of considerable interest to patients and their parents. In this respect, it can be noted that 2 of the treated girls had been held back a year in school. There is evidence that blockers affect anxiety in female mice. Calling blockers reversible in terms of effects on IQ and long-term emotional reactions to things like spatial reasoning skills, you definitely should be concerned about it. But she really ties it all up in a nice bow here.
You're a child who feels gender dysphoria prior to puberty, and your parent supports you with an environment that's friendly and non-judgmental. Wear the clothes you like, cut your hair how you want, use whatever name and pronouns that you fancy. When puberty hits, around 10 or 11, let's say, you discuss the possibility of puberty blockers with your doctor. You can go through puberty, or you can delay its onset while you think more about who you are and who you want to be.
I've addressed how early social transition and medicalization is likely to track at least some pre-gay and lesbian youth into medicalization, possibly heterosexual youth too, who would desist in the past. And now I'd like to provide a few quotes, not by right-wing Christians, but LGBT people who are concerned about this. Because it's not very conservative right-wing Republicans from Texas and everywhere else that are the main people who are concerned about this. It's really liberal gay and lesbian people and bisexual people and parents and liberal therapists in blue areas and doctors. And it's a real diversity of people who are concerned about this. Here's a clip from genetic researcher at UCLA named Eric Villain. He is also a professor of disorders and differences of sex development and precision medicine.
Many studies have shown that if you let kids with gender dysphoria go through a natural puberty, most of them will actually desist. They will not think anymore that they belong to the other gender. They will not be gender dysphoric anymore. However, most of them will become either gay men or lesbian women. That is the most common outcome of these children if there is no early social transition. And I'm actually wondering, what are we trying to accomplish here? Are we trying to accomplish to reduce the number of gay and lesbian adults? I mean, I'm wondering what is the ultimate purpose if we don't know for sure that these children are actually truly inside of the opposite gender, which I don't see much evidence for.
This is a quote from Camille Paglia, who is sort of the anti-feminist feminist, a little bit controversial, but she talks about how gender nonconforming she was as a child. Beyond that, I believe that my art-based theory of sexual persona is far more expansive and truthful about human psychology than is current campus ideology. Who we are or want to be exceeds mere gender, because every experimental persona that we devise contains elements of gesture, dress, and attitudes rich with historical and cultural associations. For Halloween in childhood, for example, I defiantly dressed as Robin Hood, a Roman soldier, a matador, Napoleon, and Hamlet. Because of my own personal odyssey, I am horrified by the escalating prescription of puberty blockers for children with gender dysphoria like my own. I consider this practice to be a criminal violation of human rights. Have the adults gone mad? Children are now being callously used for fashionable medical experiments with unknown long-term results. Here is a quote from Rupert Everett, a gay actor. And he had said this, I believe, in the Sunday Times. I really wanted to be a girl, Everett told the UK newspaper The Sunday Times, revealing he had always dressed as a girl as a child. Thank God the world of now wasn't then, because I'd be on hormones and I'd be a woman. After I was 15, I never wanted to be a woman again. But they're doing Lupron at 10 years old and estrogen at 11 years old. So you can see that in the Parents of Transgender Children Facebook group and out of the mouths of the doctors themselves that they're doing this. A lot of the young people on our detrans subreddit, there's thousands of people on that subreddit. I don't know what percent of them are detrans. It's got like 27,000 people on it. Internal polling suggests in the past a third once they said, a half another time I asked them. Who knows for sure? But a lot of them are lesbian and bisexual young women, and they're permanently medically altered. Some have mastectomies. Their voices are lowered. Here's somebody who says, I wish someone had told me that it was okay not to feel like a woman and still be one. I wish I had seen a single butch woman as a child so that I knew there were women who I could be like. That didn't happen. So I need to be that person for girls growing up after me. Here is a therapist who works with dysphoric youth, Sasha Ayad. I've heard so many female kids say things like, oh, when I identified as a girl, I was gay. When I ask, oh, do you mean that you were a lesbian? They might say, ew, gross, I hate that word, definitely not a lesbian. Upon exploring more, I realized the level of internalized lesbophobia these kids have is off the charts. They are hyper-aware of transphobia, but oblivious to homophobia, and specifically lesbophobia. So, I'm sure this therapist would be probably hated by Rebecca Watson and the trans movement and people who want to medicalize children, because people hate people who point out the way that this is harming and endangering LGBT teenagers and young adults and tweens and kids. So those people are to be hated, demonized, and despised. That's what's going on. Watson goes on to say youth can go through a reasonable progression of steps and see how they feel, and it all sounds very logical, and then get surgery at 18.
None of what I described is child abuse. What could be considered child abuse is
taking a 5-year-old who thinks in terms of gender stereotypes, completely reinforcing their disassociation with their body and their magical thinking that they can just pick any sex that they want to be, giving them drugs used to chemically castrate sex offenders and that are only given if people are very sick with cancer at age maybe 10, maybe 11, sterilizing them with cross-sex hormones, stunting their genitals, preventing them from being able to form messages in their brain that will allow them to have a fully functioning adult sex life. Then doing an experimental vaginoplasty on them, where you have to use the stomach lining and skin flaps from the thighs, and then having that vaginoplasty surgery, the experimental surgery, turn blue from cyanosis, which is a pre-necrotic state, and then split apart and then have to do 4 corrective surgeries on it. Also, that person could be, feminized, so they wouldn't have to look like Laverne Cox, who seems to look fine and be pretty successful. So, thank God Jazz Jennings did not, go through that puberty. Oh, that's not the abuse that she was talking about. I think when we're going to talk about abuse here, I think it's really important to talk about the mothers who seem extremely excited to transition their children. And I'm sorry, but this is a very real phenomenon. And I am not talking about parents that are dealing with very consistent, anxious, persistent young people. I know that that's real, but there are definitely usually mothers who seem very almost enthusiastic about medicalizing their children. Even when their children are expressing doubts, they seem to want to push them in that direction. They like to parade their child out in public. If you go on to the parent Facebook groups, there are parents that have 2, 3 trans-identified children, including somebody who commented on Rebecca Watson's video, who said that they had 3 trans children. I don't know why this isn't scaring people like her, because there's going to be some therapist that's just going to, push them on through with their letter, and some doctor that's just going to give them puberty blockers with no questions asked. That's what's going to happen. We call some of these moms Transhausen moms. And there's actually an older study that shows that there's an association with boys, male children with gender dysphoria, and mothers with borderline personality disorder. Munchausen by proxy is probably some kind of variation of borderline personality disorder, which involves some pretty bizarre behaviors.
You suddenly think about killing yourself at twice the rate of your peers. You have a 40% chance of following through with that thought. There's a reason doctors refer to the use of puberty blockers in trans youth as literally life-saving. A large-scale survey conducted last December found that gender-affirming care for trans and non-binary teens resulted in a significant drop in depression, suicidal thoughts, and suicide attempts.
Suicide is very, very serious, and I'm very committed to discussing it as honestly as possible. So part of me can't blame her for pushing this narrative, because you constantly hear this life-saving, medically necessary narrative. The studies are bad. The ones that are promoted are cherry-picked, and you just constantly hear this drumbeat. And it's actually very complicated. So please just don't talk about this issue until you're willing to put in a couple months of research of looking at all of it, because suicide is socially contagious, and this message that trans kids are going to kill themselves and that people hate them because they don't want them on sports teams is everywhere, and it's permeating social media. This is bad for their mental health, and this is all well established in suicide prevention organization guidelines. So we want to be very concerned about suicide, and we don't want to exaggerate it, and we don't want to downplay it. But I left a link that we put on our website, which I think is very ethical and tried to present studies in a balanced way. Some studies show that medicalization seems to help, and there's a few also key ones that indicate that even for adults, medical transition might not solve the suicide issue, because it has to do with other mental health problems and difficulties and problems just accepting the body. So overall, they really scare parents about adolescence and suicide. It's shown to be very rare in clinics. A couple of people looked at that in Canada and the UK, so that's good news. So yeah, let's just be calm when we talk about this issue. She goes on to cite Austin, Green, and Tordoff to support this helpful, life-saving narrative. I'm going to place a link below to something called the NICE review in the UK that talks about the reality that these are very low-quality studies, that the evidence is not very strong to justify this protocol. So you can refer to that. NICE is the National Institute of Health and Care Excellence in the UK. They said that studies of these drugs were small and subject to bias and confounding. There's a site called SAGM. They are, I believe, doctors and mental health professionals who are picking through some of this data, finding problems with it. They are summarizing the study here. It says the review of GnRH agonists, quote, puberty blockers, makes for sobering reading. Its major findings is that GnRA agonists lead to little or no change in gender dysphoria, mental health, body image, and psychosocial functioning. In the few studies that did report change, the results could be attributed to bias or chance and were deemed unreliable. The landmark Dutch study by De Vries et al., 2011, was considered at high risk of bias and of poor quality overall. The reviewers suggested that findings of no change may in practice be clinically significant, in view of the possibility that studies subjects to stress might otherwise have increased. The reviewers cautioned that all the studies evaluated had results of, quote, very low certainty and were subject to bias and confounding. So they then go on to say that there's similar problems actually even with administering cross-sex hormones. Here is another quote about the puberty blocker study out of the Tavistock Clinic in the UK. And it says, preliminary data for 30 of the 44 young people on the study was made available to the Tavistock board in 2015. It showed that after a year on puberty blockers, there was a significant increase found in those answering the statement, I deliberately tried to hurt or kill myself. Michael Biggs, the professor I mentioned earlier, is one of the people that went through this information to glean out what was really going on. I also recommend looking at the Brandstrom study. It's from the public health care data in Sweden, which is better than an internet survey study that initially tried to say that cross-sex hormones and surgery reduce mental health problems and suicide. They had to correct that study because it actually proved no such thing. Because of this information that I'm talking about, Sweden, France, Finland, the UK are all very concerned about this protocol and are stopping or reviewing the protocol. We also need to worry about the mental health of the increasing young people with transition regret. And we need to worry about people like this young detransitioner, 17 years old, detrans kid, started T and blockers at 13, top surgery at 15, detrans at 16. It's a 17-year-old. There's going to be more.
And then another big study that I only saw literally right before I went to film this, it was published last week. It found exactly the same thing. Gender-affirming medical interventions were associated with lower odds of depression and suicidality over 12 months. These data add to existing evidence suggesting that gender-affirming care may be associated with improved well-being among TNB youths over a short period, which is important given mental health disparities experienced by this population, particularly the high levels of self-harm and suicide.
Sorry, Rebecca Watson, but Tordoff appears to be a terrible study and did not prove what it said it was supposed to be proving. And maybe that's not your fault because you just looked at the abstract before you made your video. And this information is often spun and misrepresented, and several of the studies are quite bad. You have to understand that you have to be actually skeptical about these trans healthcare studies that you listen to. It's a very politicized issue. The doctors and therapists who are involved in this appear very motivated to present a very positive image of what's going on. They're also taking over writing the guidelines for these organizations, even though they don't really represent the tens of thousands of doctors and therapists that actually are doing work. I know for a fact that there are false statements in Tordoff about the quality of the research, because that I know. I'm not a statistician, but other people went through the study and found major problems with it. Here's an article in My Northwest. Researchers found puberty blockers and hormones didn't improve trans kids' mental health. Here's a quote. There was no difference when assessing anxiety. At the start of the study, 51% of teen patients not receiving gender-affirming care reported severe to moderate anxiety. By the end of the study, 51% of the patients receiving gender-affirming care still reported severe to moderate anxiety. Here is Jesse Singal's article. Researchers found puberty blockers and hormones didn't improve trans kids' mental health at their clinic. Then they published a study claiming the opposite. Here is Singal's quote. I think the political environment is exacerbating things, unfortunately. At the state level, Republicans are seeking out genuinely bad and harmful policies. In Texas, what Greg Abbott and Ken Paxton are trying to do can only be described as state-sanctioned child abduction. It's horrific. So part of what's going on is there's a race to prove just how wrong these politicians are and to produce evidence showing the treatment works. As Tordoff and her colleagues put it at the end of their paper, our findings have important policy implications, suggesting that the recent wave of legislation restricting access to gender-affirming care may have significant negative outcomes in the well-being of trans NB youth. This is, again, a paper that found that kids who went on blockers and hormones did not improve. The science has become completely intertwined with the politics.
The science on this is crystal clear. The rational guidelines doctors have set up to treat kids with gender dysphoria are working. They aren't just safe, they're necessary to save lives.
Here are some more conservative doctors and their perspective in the New Atlantis. But it seems equally plausible that the interference with normal pubertal development will influence the gender identity of the child by reducing the prospects for developing a gender identity corresponding to his or her biological sex. And here is a liberal-sounding pro-LGBT psychologist from the Tavistock Gender Clinic. Wren said future generations might condemn the way such children were being handled. Of course, you have to think that in another generation we will have done something which is not regarded as having been wise. She also acknowledged that some youngsters could regret their decision to change gender when they grow up and that there were risks involved, including the loss of ability to have children, particularly for those born as boys. Bob Withers, another very liberal therapist. He's a Jungian analyst. He's worked with many trans adults, and he's not opposed to them transitioning. And he said in a video, which I'll link, I think the trans affirmatory lobby has unconsciously and unwittingly channeled this generation into a load of unnecessary surgery and medical treatment. I think my profession, our profession of psychologists, has been complicit in that because we've wanted to be nice. We don't want to offend people. We want a virtue signal to each other, and we don't want to repeat the horrible mistakes that we made with gay people by pathologizing them. But to be gay, you don't need surgery and you don't need hormones. So I think we've let down particularly this young generation of trans kids, and so I'm concerned to try and understand how that's happened. My own internalized fear of being transphobic led me to let down one of my patients. I think we're all working under a cultural constraint here, which is not helpful for anybody, least of all trans kids themselves. Here is that same UCLA genetics researcher, Villain, the guy who asked if we want less gay and lesbian people. Physicians are far too willing to recommend social transitions for children. As a result, Villain believes the vast majority of children currently undergoing social transitions in the U.S. might not actually be transgender, and thus might not be best served by embracing a sex that doesn't match their gender. If the children are pushed in this belief, it will be much, much harder for them to get out of this belief because everyone will have agreed on it very, very early on, Villain said. What worries me is that indeed there might be in the upcoming years a considerable number of these children that are placed on a path that we don't fully know the outcome. And again, I can list a lot of social factors that reinforce gender dysphoria in people.
As we've seen with other issues like abortion care, doctors and scientists have no need for politicians like Greg Abbott to insert themselves where they do not belong.
Even opposers of pediatric transition, which include some trans people, don't like the idea of going after parents. I think what most of us want are lawsuits against negligent therapists and doctors. But again, there have been pushes for the reverse to happen, to take even unstable children with other problems away from parents. There have been cases where governments have had to step in. There are a lot of harmful things that doctors and mental health professionals have done in the past to people. So there are no gods here, only God complexes. It's also important to know that, Saki is making statements to the public that this all sounds very healthy and safe and necessary. And these are all very unethical claims for the Democratic Party to be pushing.
Fuck Greg Abbott. Fuck the prospect of fines and jail time and CPS investigations. I'm going to love my kid the way that they deserve to be loved. Like, it just makes my heart really full. Sorry.
Appeals to emotion are not always a bad thing. They're a legitimate part of the big picture. But I think that her emotions are definitely clouding her personal judgment, as well as the level of effort she put into maybe debunking her worldview here. She didn't really give a fair airing to any of the very reasonable concerns and the very legitimate harm that is actually happening to young people. Only fuck yous and the like. What I would like to ask is if maybe Watson would have tears for these kids and young people whose stories are featured in an article called "It Feels Like Conversion Therapy for Gay Children," say clinicians. There are a bunch of clinicians who quit the Tavistock Clinic. I would like to say that if gender clinicians are quitting gender clinics, you might have a child safeguarding problem and an ethics problem. Here's some quotes. So many potentially gay children were being sent down the pathway to change gender. 2 of the clinicians said there was a dark joke among the staff that there would be no gay people left. It feels like conversion therapy for gay children, one male clinician said. I frequently had cases where people started identifying as trans after months of horrendous bullying for being gay, he told the Times. Young lesbians considered at the bottom of the heap suddenly found that they were really popular when they said they were trans. For some families, it was easier to say, this is a medical problem. Here's my child. Please fix them! ! Than dealing with a young gay kid. At the service's family days, a parent was allegedly heard saying that they did not want their child to have gay friends because they didn't want them mixed up in that hedonistic lifestyle. It is converting people into heterosexuals, one of the clinicians said. We had so many families who would talk about not wanting their daughters to be lesbian. Young people repeatedly confiding their own disgust that they may be gay, according to the clinicians. So Watson talks about how warm-hearted it is that, parents are going to be loving their trans children the way that they are. What about gay kids? Pre-gay kids. I don't like to ascribe sexual orientation to children until they've really matured. But it's good to know that in some Islamic countries, it's acceptable to be trans, but not a homosexual. And they actually force them to transition. Back to this article. One case has haunted her. All the pushing was coming from the father to put the kid on puberty blockers. Thinking back on it now, I feel that the father was a pedophile and the child was being abused. There is no suggestion the service knowingly ignored the case, and the outcome is unknown. She would have nightmares about her years at the Tavistock. I would talk about it as an atrocity. I know that sounds quite strong, but it felt as if we were part of something that people would look back on in the future and ask, what were we thinking? In the future, I think there will be lots and lots of detransitioners who feel that their bodies were mutilated as young people, and who will ask, why did you let me do this? It's very disturbing. Here's another quote here from a WPATH member talking about all the young adult clients they've had from 2015 to 2017, all females who now don't identify as trans or non-binary, who have transition regret and regret about their double mastectomies. That was a few years ago. It's gotten worse since then. Transition ruined my health and, frankly, my life. I feel insulted when people ask me to see this as a fun journey or exploration with gender. It was spiritual suicide for me. It was self destruction. It was traumatizing. Here's another 17-year-old with top surgery regret. Another one that feels sad about how they sexually interact with their partner now that they don't have breasts. There's a lot more that I could read. Lisa Marciano. Therapists need to start developing expertise in helping detransitioners. There's a growing demand for such services. The young people I have spoken with are dealing with many issues familiar to trauma victims, such as shame and self-blame.
Sorry for tearing up, but thank you for watching, and please stay safe out there.
In the end, Rebecca Watson didn't really attempt to air all of the facts, just to spin things her way, the way that she wanted to see it, the happy clappy way, the way that we can all turn away and sweep under the rug the young people who are being harmed, and then just repeat fuck you to right-wing Republicans who she doesn't like. I don't think Skepchic is a good name for her. I think maybe Genderborg chick, or maybe SJW chick, or possibly, sure, I'll castrate some baby gay kids for my amazing agenda chick. Thanks to Rebecca Watson for proving once again that the skeptics community is some bullshit.